Canadian kids received a failing grade today in a report card on physical activity. Canadian children scored D- overall. Kids aged 3 and 4 did the best, with 70% meeting the daily activity levels, but older children were way off. Children ages 12 to 17 did the worst, with only 5% of Canadian children getting enough activity. The report says Canadian parents need to get their kids outside, give them more freedom to boost their activity outdoors. Joining us now is Dr. Dina Kulik. She is in Toronto, an assistant professor in the Department of Pediatrics at the University of Toronto and the founder of drdina.ca, an online resource for information on kids' health. Hi, doctor. Good to see you.
Good to see you.
So these are pretty troubling results, are they not?
For me, yes, absolutely. It should be troubling and concerning for all Canadians.
So tell us what happens here, because obviously when our kids are very young, they score okay. But it seems the older they get, the numbers get worse. What's going on?
I think a couple of things. Once kids get into school, they're spending many hours inside. Then they have hours of homework after school. And then most kids end up watching a lot of screens, playing on their iPads, watching TV, playing on their computers, for the rest of the evening, and then they go to bed.
Yeah, a lot of people are pointing the finger at parents, too, who are overprotective, won't let their children outside without supervision, won't allow free play. They want organized play. What do you make of that?
So the report did show that kids that have parents that are, overprotective, the helicopter-type parents, they do spend less time outside, get way less activity than they should. The fears are a bit unfounded. So the risk of being held hostage, for example, in Canada, according to the RCMP, is less than 1 in 15 million. And the risk of minor cuts and scrapes and things, those are really minor compared to the risks of not, spending enough time outside, not getting enough physical activity.
Well, tell us about those risks. What are the long-term health risks of inactivity for kids?
Right. So, the common culprits we think about often: obesity, high blood pressure, diabetes, heart disease, certain types of cancer.
Is this in kids? Are you talking about heart disease and diabetes in kids?
Well, it leads to that. So sure, there's lots more kids now that have diabetes type 2 that is a result of obesity and sedentary lifestyle. We see diabetes affecting kids much, much younger, high blood pressure affecting kids much younger. And then, of course, into adulthood, we worry about the heart disease and the cancers and mental health issues, too. That's one thing that's often overlooked. Depression, anxiety, much more common in kids and adults that are sedentary.
So if we want to fix this, it's going to be my guess you don't have to get the kids' permission to do this, because kids like to play. I think you have to get the parents on side.
100%. A lot of it is modeling. So getting outside as a family, running around, playing catch, going for a hike, going for a bike ride. There's a stat in Canada that less than 50% of kids have ever done a cannonball into a lake or water. That's depressing to me. It's one of my favorite activities to do when I was a kid, and still is, right? And for my children, too. So we should get outside. I'm helping to champion a program called Get Outside Day. You can check out getoutsidecanada.com, and it's encouraging exactly what we're talking about. Getting outside with your family, playing, going for a hike, having a picnic, spending time as a family outside.
Yeah, it'd also be helpful if you could get educators on site and schedule an hour of phys ed a day, wouldn't it?
Huge difference. We should bring that back like we did when we were children, and doing it outside as much as possible. Why play basketball inside when you could do it outside? Why not make, snowmen outside in the winter? We don't need to be cooped up all winter long, too.
Dr. Dina Kulik, assistant professor in the Department of Pediatrics at the University of Toronto. Thank you very much for this. We appreciate it.
Thank you.